Friends, prostate diseases affect men in the prime of life. From 40s, 50s onwards till 70s and 80s, a progression in change, which is all about prostate undergoing a change that you and I know as enlargement, also translates into an obstruction or an occlusion of the urinary passage. On one side, a sonologist continues to examine and pick up the size of the prostate. On the other side is the pickup by you as an individual about the flow of urine. And that's where the entire aspect is. So prostate changes can bring about obstruction to the flow of urine, and that does not happen in a day. It's a progressive, gradual change which men go through. And as they go through this change, they probably continue to adjust, improve, compensate to the progressive change of obstruction to the flow of urine. So don't forget that every man in his 40s, 50s commences with this change, and in 60s and 70s has got symptoms which are significant enough. And thereafter are the age group where people can get obstructed, can get blocked, and sometimes can be difficult. So our job here today to make you aware is to take you forward to the next level where you pick up these things early. Prostate change, not an enlargement alone. Enlargement could happen in many, may not happen in some. So a small prostate may still occlude the urinary passage, and a large prostate may sometimes not occlude or block the urinary passage. The examination which picks up the sonography changes of enlargement of prostate only gives you the size. But size is not an important issue. Is your age so important in terms of the change in maturity? The more the age, more the experience. Similarly, more the size, possibly more the obstruction, but that is not true. Sometimes a very small prostate also can block the urinary passage internally, and medicines may not be effective. So time today to wake up to this important phenomena, to see your urologist with your prostate score, or what we call as IPSS symptom score. It's available on the net. If you open up IPSS symptom score, it'll rate you as mild or moderate or as severe. So if you are mild and you have got symptoms, we can prevent you from becoming moderate. If you are moderate, it's important to turn you to mild. And if you're moderate turning to severe, then you are in the situation where your medical treatment is happening. Your family doctor, your urologist in your city is busy giving you medicines and you're not improving. And that will not help you. So plan today is to wake you up to a phenomena from where obstruction should not progress to a point in time where it becomes almost an emergency. It is a natural phenomena that we age gracefully. And this graceful aging is with so much of busy schedules and life that we have, where we miss out this important aspect of progression beyond a point in time. So once you reach the boundary, you may slip down. You may have burning, you may have infection, you may have bleeding in urine. Your urine flows down and becomes lesser and lesser on the speed. Sometimes you may get completely blocked. Sometimes the bladder is too full and you land up in the retention of urine. Or the suffering is so much that the bladder transmits the pressure to the kidneys. You land up with swelling in the kidneys called hydroureteronephrosis. So friends, prostate change cannot be escaped. People go through it. All men in their 40s, 50s commence to have it. And if you're so young and having a problem, please see your urologist. If you don't have one, be aware that your fathers and grandfathers do have it. And it's time for us to wake up and get evaluated. For me at the Kokilam Dhirubhai Ambani Hospital, it's important to wake you up to this phenomena because we get to see people very early or obviously very elderly. So very early are those people who have got their complaints getting significant and progressive, and they have been on treatment with somebody, or they are naive completely with no treatment started before, but they have either done a health checkup or they understand the significance of the complaint which is not getting treated with whatever erstwhile therapy has happened. So it's time to wake up to that phenomena early. For those who are late, that means they've been treating with medical management for a long time and not getting the result. Or there are those individuals who have already got completely obstructed and living with catheters. I think it's time to come out of this. So are we living with a disability, or can we leave the disability and come out of it? A lot depends on between you and your urologist. In cities and countries where people live, the progression of this change cannot be picked up only by men. It's many a times a urologist involved who checks your PSA or prostate specific antigen, who obviously looks at your sonography and looks at the changes happening, which are silent and progressive. But at the end of it, he also looks at the test which I called as ECG of the bladder, the uroflowmetry. Metry is measurement, flow is speed, and euro is urine. So the progression in change of your uroflowmetry towards from good to bad to worse is almost a natural downhill course, something which can be completely prevented. This entire wake-up call is today because I see so many young men coming with so significant urinary symptoms, and there are treatments available. There is cure available. So why continue to get treated all your life when you have something where you can cut it short and get treated completely? From the era when we used to do the prostate surgeries by TURP and holmium laser therapy, which still happen to be gold standard on one side, to very large prostates that I treat now robotically and clear the entire prostate internally, be it a cancer prostate, be it a very large prostate, which we can remove it internally without damages and injuries and any kind of an emergencies created. There is a minimal invasive surgical treatment missed, like the one which we have prostate urethral lift, something which actually helps you to prevent any ejaculatory or erectile dysfunction, which prevents any major surgery, but a telescopic job where we enter, clear your prostate by clipping it and putting those implants where the prostate opens up completely and you're passing urine without a major surgery. So changes are inevitable. For us to wake up to a phenomena, take it forward to the next level is what is the motto of today's attempt to wake all of us up. So friends, if you're in your 40s, 50s, and 60s, let more and more people know that these changes are not acceptable. They're not acceptable that we continue taking medicines with our family doctors without getting evaluated, because one fine day a change may be also going in another direction, which is called as cancer prostate. I get to see more and more of these individuals coming in, where either we do a radical robotic prostatectomy and clear the entire prostate cancer, which was picked up very early, or sometimes people come very late, where we have to do a channel TURP, clear the prostate, give a hormone therapy, and take it forward. So prostate has got many ramifications. Only a urologist teaming up with you in your city, in your location can help you out. And therefore, don't miss it out. To me, at the Kokilabin Hospital, this passion is about making people wake up. Apart from the continued work that we do, we also are very deeply involved in this awareness to awakening drive, which people need to know. Men miss out and they come with their fathers and grandfathers and they understand that their time also may come. It's important for us, each of us, to wake up to a phenomenon that if there's a change, if there's a complaint, or if a health checkup picks up some trouble, I think we'll see our doctor in time and get it sorted out. Thank you so much.